Hello and welcome back to Therapy Talk with Tammy and Pauline. And so today's topic, just getting right into it, is about self-harm or self-injurious behavior. And so this means that we might have topics or we're going to have certain things that we share that may be triggering for some people. And if that happens, stop watching the video and, get some help. We have some information in the description for that. Also, self-harm, self-injurious behavior is a term that was known as self-mutilation. It's not very commonly used anymore, but it means the same as self-harming and self-injurious behavior. But for today's content, we're just going to stick with self-harm just because we all know that term. So what is self-harm actually? So it's basically an act of harming one's body. It's typically not meant as a suicide attempt, but for mental health professionals, when someone is engaging in this type of behavior, it still alerts us to check for suicide. It is a way to cope with an emotional pain. It's a type of coping skill. It may bring a sense of calmness initially and release that emotional pain. Self-harm may be followed by feelings of guilt, feelings of shame, which could lead to more self-harming behavior. People who self-injure or self-harm may feel like the only way that they can express these emotions is through hurting themselves. So it's a way to cope with something, right? Now, you may be asking, why would someone self-harm? Why would anyone do this? Well, there's multiple reasons. And so the reasons that we're going to list today is in part, it's something that's happened to an individual. A lot of our experiences is because of our childhood. It may be childhood trauma. And you learn that when I do this, it helps me feel a different way. So that's one reason. Symptoms of depression could be related to that as well, and anxiety. So as you're probably catching on the vibe here, it's a lot of feelings based. So you're feeling a certain way. So to change that feeling, you're doing something else to feel something else, right? So anxiety and other mental health issues might induce self-harming. Desire to release pain. In some cases, self-harm may be sudden or may be impulsive. So we're going to give y'all a list of different types of self-harm, and then you may get more insight into why we say this could be impulsive behavior. In other cases, it's an attempt to try to gain some control in life. And that, depending on what's going on in our lives, life is hard. Like that's one reason why people do this, why people engage in self-harm. Life can be hard. And so to gain control, if things are going in a way that you don't necessarily like, you're going to find a way to cope with that. So self-harm. And we're not judging people who engage in this behavior. Tammy and I are very much understanding in why people do it. And so our goal on this channel is to destigmatize and to normalize mental health. And so we wanted to create this content to share so that you have more information on why people do it and what it could look like. Right, Tammy?
Yep.
Yeah.
So we are going to move into types of self-injury / self-harm, of course. Self-injury is typically done in private, but not always. Examples of self-harm can include cutting, scratching, burning, using ice, punching or banging head, overeating or undereating. It could be having unsafe sex or unsafe practices in general, putting yourself in danger and maybe putting yourself in dangerous situations. It could be poisoning oneself, i.e. drinking bleach or Drano or something like that, hair pulling, pinching or biting, excessive exercise. This is a tough list, Pauline. Inserting things under the skin. It could be piercings or tattoos. We're not saying that that's a bad thing, but sometimes that can include examples of some self-harm, and increased substance abuse. So basically, self-harm can include anything where a person is able to hurt themselves. So it can include lots of different things. So let's look at signs.
Oh, sorry. I wanted to emphasize something that you're sharing, which is because some of these examples seem like things that are regular, right? Like ice. Like, how can using ice be so harmful? Or how can getting tattoo or piercings and things like that be a form of self-harm? And I think we need to highlight those things because, again, self-harm is attached with shame and guilt. And so you're going to hide that you're doing it. And getting a tattoo, getting a piercing, using ice and things like that isn't necessarily something someone will say, oh, you're self-harming by doing this thing.
Yeah.
So we list those things because it's your way of hiding it or the person's way of hiding it. But it's also an intent of releasing some type of emotional pain.
Awesome. Thanks for referring to that, Pauline. It's very important that we get that message across.
Yes.
Okay, so signs and symptoms. Most of the time, self-harm is done in private. They try to hide it, like Pauline said earlier. They might wear long sleeves in warm weather, or they might wear, heavy coats and things like that in warm weather. They might have fresh cuts, bite marks, burns, or bald patches. They might start displaying more depression, maybe more anxiety, and isolation. Self-harmers usually have the urge to hurt themselves before they act on it. So they think about it prior and ahead of time for the most part. There are those that impulsively do it, but for the most part, they do think about it before they actually do it. So complications with self-harm can include increased feelings of guilt and shame, low self-esteem, infections or permanent scars. It could be severe. It possibly could turn fatal. And it could increase the underlying issues, and it could get worse over time. Take a deep breath, everybody. This is a hard topic. So now you're aware you're getting thoughts of self-harm, but let's find appropriate and healthy distractions. Pauline, can you help us out with that?
Yes, I can. Thank you for the extensive list, and it's not limited to what Tammy shared with us today. Some distractions or coping skills is what we're referring to here. Dancing, moving, exercising, move your body, go for a walk, just to distract yourself from that urge, that thought you're having. Draw, doodle, color. I know that there's some clinicians who would recommend that their client may use Sharpies on your skin if you're having that type of urge, and you can just draw on your body. Not with the pen, nothing sharp. Sharpie is soft. Journaling or writing down what you are feeling and thinking. I love that one. Calling a friend, a family member, or do something together with them. So being inclusive with the people around you. Watching some TV, maybe playing video games, something fun to distract yourself. Reading, listening to music. Just move your body. Think about things you are grateful for. So maybe gratitude journaling or something like that to get your mind out of that place. Can we prevent self-harming behavior? We can try. So what are some things that we can do as this is happening, or if you're having thoughts about it? Something you can do is seek professional help. Talking to people like Tammy and I, maybe you're seeing your primary doctor and that's the only person you have connected with. Talk to them. They can refer you to someone to talk to about these feelings and these behaviors that you have. No judgment zone, by the way. Utilizing new coping skills that you've learned. Reducing isolation, identifying your warning signs. There's something that's going on that's going to tell you, oh, wait, I'm I'm triggered basically. And so you need to learn what those things are, and maybe sharing it with the people that you're closest to so that they can say, hey, you good? That way you reduce that type of behavior. So the following thing I'm going to share is for a parent or loved one with someone in their life that is engaging in this type of behavior, or you may suspect that they are. Well, one, it's okay to talk to that individual. Don't accuse them that they're doing something. And again, consult with a professional to help create a safety plan, or even consult with a mental health professional to have this discussion about what you may think is going on. Include that individual so you're not talking behind their back or anything. And now this message is for individuals who actually engage in self-harming, or you're thinking about it. Talk to a trusted person or adult, trusted friend, family member. Get some medical attention. If you did engage and the wound is open, we want to limit that type of infection or creating more harm on yourself. I know the goal is to harm yourself, but maybe you didn't plan on cutting so deep or something like that. So get some professional help. No judgment. Emphasizing getting professional help. For those who are in school, there's school counselors out there that can help you. Your school nurse can help. If you think you're being a burden, no, you're not. It's their job to help you. Do not isolate. Please, please, please do not isolate. So that's what I have, Tammy.
Yeah, and we preach that a lot on our channel, is not to isolate. I'm starting to see a trend of isolation could be bad, Pauline.
Indeed.
Yes. So bottom line, if you are self-harming, or if you know somebody who is self-harming, getting appropriate help is very, very important. If you get anything at all from this video, remember this, that any form of self-injury is a sign of a bigger issue, and that is what needs to be addressed. As always, thanks for coming here. We appreciate you and love your support for our channel. Stay safe out there and always be kind to yourself. Pauline and I will be back later for more content. In the meantime, bye.
Bye.